lessening the impact of COVID-19 in Wichita's minority communities.
Thank you all for coming. We're going to go ahead and get started. I want to first start by thanking each of you for joining us today. I'm Tijuana Hartwell, the owner of Mamarazzi Communications, a strategic marketing and communications company based here in Wichita, Kansas. I am proud to be a part of the Facts Not Fear ICT efforts, an effort that will undoubtedly be responsible for saving lives. I will serve as the community outreach and marketing manager. Facts Not Fear ICT is a communication and outreach initiative committed to lessening the impact of COVID-19 in Wichita's minority communities. National and locally, minority communities have been disproportionately impacted by COVID-19. This campaign strives to improve health literacy, address health disparities, and positively impact health outcomes among Black and African American, Asian, Hispanic, Latino, Native American, and other vulnerable communities. Through marketing efforts, community outreach, data gathering, and more, this initiative connects members to Wichita's minority communities to vital information and resources such as food access, COVID-19 testing and vaccinations, housing, mental health services, and other important supports to protect and save lives. The Facts Not Fear ICT initiative is proud to include the voices of minority community members, community leaders, health professionals, business owners, and influencers to create and disseminate culturally relevant messaging. Throughout the campaign, Facts Not Fear ICT will work diligently to ensure adequate access to culturally sensitive health information. To ensure that they are best served, each minority population has dedicated community facilitators, which you will meet here soon, and they are tasked with connecting them to health education material and resources while also engaging minority residents in community listening sessions to help guide the work of these efforts. Additionally, the initiative is steered by a local advisory council made up of healthcare leaders, nonprofit representatives, and community residents to assist in guiding the campaign. This initiative is a collaboration between the City of Wichita and Community Connections Consulting Services, LLC, and funded with $4 million from the Advancing Health Literacy to Enhance Equitable Community Responses to COVID-19 grant. We are immensely proud of that, and we're hopeful that for what it's going to do for our city as we push forward putting the devastating impact of COVID-19 behind us. The grant is administered through the U.S. Department of Health and Human Services Office of Minority Health. The OMH awarded $250 million in grants to 73 local governments as part of a 2-year initiative to identify and implement best practices for improving health literacy to enhance COVID-19, vaccination, and other mitigation practices among underserved populations. We are glad to have been selected as one of those government entities. The Office of Minority Health is dedicated to improving the health of racial and ethnic minority populations through the development of health policies and programs that will help eliminate health disparities. The City of Wichita Community Connections Consulting Services, LLC, Mamarazzi Communications, our team of community facilitators, and Facts Not Fear ICT's partners are all committed to positive outcomes for this campaign and the impact that it will have on individuals, families, and Wichita businesses. This work is truly inspired by the work that we did last year as members of Wichita Black Alliance. We were responsible for helping save so many lives in the African American community and others. It's so important to notate that type of work. At this time, I wish to acknowledge some of our special guests. If you may, please stand. Our community facilitators. The City of Wichita, Sedgwick County Health Department, our elected officials. Go ahead, y'all can stand. And also our partners. We thank each of you for your support of this important initiative. Thank you so much. We will continue in our program to share additional information about the Facts Not Fear ICT initiative, the nature of the work that is to come, and more details about the grant. I want to remind you that before leaving, we would love for you to go and visit our photo backdrop. Also, We have videographers in the adjacent room, and they're happy to record a brief video drop to show the importance of this initiative. Thank you so much to See Every Dimension, who is our vendor for that work. I'll now invite up Representative Gail Finney, who is here to speak about some of the work that we did last year as Wichita Black Alliance. Thank you so much.
Good evening, everyone. As you said, my name is Gail Finney. I'm state representative of the 84th District in Northeast Wichita, but I was also a member of the Wichita Black Alliance. Back in the summer of 20, I guess it was, that time has really passed. Back in the summer of 20, a group of people got together and they had this idea about we have got to get out there and combat the COVID virus by educating the African American community to save lives because it was disproportionately affecting the Black community. So that particular group, with the WBA, the Wichita Black Alliance, I was so proud of that group. I mean, they pulled together. We had meetings weekly, seemed like a couple times a week. But it was consistent meetings, coming up with ideas and ways that we can combat, particularly the misinformation about COVID. And the goal was to get people in masks and to be able to convince them to get the vaccine. It took a lot of effort, but some of the things that was done is, you're probably seeing that we had big old signs around in yards and in businesses, and we had flyers, and that's just a few of the things, like magnets, and they really did a great job of marketing that particular campaign. It really helped get the word out, and the community was very aware of what was going on. That collaboration, it started with, like I said, different people in the community, and then it included collaboration with organizations and elected officials like myself, our distinguished Councilman Brandon Johnson, which you will hear later, Senator Faustido, Representative Casey Hobson, the Council of Elders. It was a large collaboration of people that worked together. That's sometimes one of the things that you don't see, is a lot of people working consistently together for a common goal. But that group was very effective, and so here we are today with a grant that can really make that literacy education and health component for not only the African American community, but other cultural communities throughout Wichita. I think that this is a blessing, not only for Wichita, but I think that we're going to be so successful, particularly under this leadership here that you see. These ladies are dynamic. They are wonderful. Just look at this event here. That just tells you a lot. And the organization and the planning and the fund writing, that is not something that you can just do with no skills. You have to be able to have the skills to do that. And if it wasn't for this particular team, I don't think we would be here today. But I look forward to this not only being a roadmap for Wichita, but other cities and maybe other states will take a look at what we've done here in Kansas. But it all started with an idea and a few organizations coming together, working together hard to really combat this COVID-19 virus and to educate our community and make sure that our literacy, as far as like with help and understanding and getting rid of that misinformation, is really put out there in the community. So I want to thank you all for doing what you do. I am so proud of you. I'm inspired by you, and I know we're going to see a lot of great things to come forward out of this. And without you, hey, we will probably still be suffering here. But thank you so much for all that you have done, and continue being the badasses that you are. Thank you very much.
Good evening, good evening, good evening. My name is Angela Johnson, and I am the CEO of Community Connections Consulting Services and also the project administrator for this initiative. And it is such an honor and a privilege, and thank you, Representative Finney, to be able to be here in celebration and acknowledgement of what is taking place and what's been made possible and what will be made possible through the award of this grant. A little bit about Community Connections Consulting Services. Community Connections Consulting Services, that's a lot of C's, so I always say C3S, is a consulting firm that works with nonprofits, governmental bodies, and for-profits organizations that are engaged in community development and engaged in activities to change and impact lives. That is our purpose, that is our passion, and this effort is absolutely representative of what we stand for. And it's an embodiment of something that we say and we hold true to the work that we do. We work for changing communities through impassioned thought paired with emboldened action. And that's what this is, and that's what this will continue to be, because there are literally lives at stake. And I've been very transparent in my own dealings and challenges with COVID. This time last year, I had COVID. This time last year, after 2 weeks of having it, actually probably tomorrow is my anniversary of ending up in the emergency room with pneumonia. Not sure what was gonna happen next. But I'm here, but I can't say that for some of my family members who literally died from COVID. So this is something I take to heart and I take seriously, because I recognize personally the impact of COVID in our communities. And not only in my own experience or in the experience of my family, but as I interact in my community, as I have conversations at my place of engagement for work, as I connect with others, there are repeated stories about the negative, harmful, and literally deadly impact of COVID. So again, this is not something that's taken lightly. This is a work that is truly about saving lives. So while others may criticize or challenge the intent, recognize this is a work that is truly about saving lives. So we're here to celebrate. This is a kickoff. It is a celebration of the fact that we have been selected 1 out of 73 in the nation, the only in the entire state of Kansas, to receive the full amount possible of $4 million to impact lives in this city. So with that, I'm going to ask Dr. Elizabeth Avila from KU Med, or the University of Kansas School of Medicine, Office of to come and share some more details and specifics about what's happening, what are the facts about COVID, both nationally, statewide, and specifically here in Wichita. Dr. Avila.
Hi, good evening. I'm usually in control of my slides, so this is very disorienting. I'm Elizabeth Avila, KU School of Medicine, Wichita. I am a professor in the Department of Population Health. It is an absolute pleasure being here with you this evening. Thank you all so much for coming out, especially the weather, because it was so lovely and now it's really starting to turn. So thank you all. So if you wouldn't mind, let's go to okay, terrific. So it's showing, that's unfortunate you're not able to see the top of that, but it is the number of tests per 100,000. So the way we look at, in public health, the way that we look at COVID data, we could look at just numbers, but because we have a lot of people who are white or Caucasian in this country, in the state, in Wichita, it's hard to compare one race or one ethnicity to another. So what I've done here, and actually it was not me, the data were provided by Sedgwick County Health Department, so thank you very much, Adrian Byrne, for that. But this is the number of tests per 100,000 that have been conducted. I'd like to just point out that in the blue is Wichita, and it's going to stay blue. Kansas is going to stay red throughout all of these slides. So, and we do have some U.S. slides as well, but a lot of the United States data do not include race and ethnicity, which is really fun. That's sarcasm. So you can see here, white, we're doing really well in terms of how many people are getting tested. African American as well. Asian really increased, especially over Kansas. American Indian, Alaska Native, we have some work to do. For sure. And Hispanic Latino, again, the number of tests doing better than Kansas, but we really have a long way to go, right? If you don't mind, go to the next slide. Is that the next? Oh, God bless you. Thank you very much. That's very helpful. All right, so now that we have the test, we know that these folks have been tested. Now, how many are positive? So again, we're looking at the per 100,000, so we're looking at per population. So you can see white, definitely about the same as Black or African American. These are recent data, so this is not from the early on days. So I'd like to make that as a distinction, that the numbers have significantly changed and continue to change, as you'll see in a moment. Asian American, we are definitely seeing a huge high positivity rate. American Indian and Alaska Native, and you can see then Hispanic. So we have some work to do, very clearly. This is who has been tested and identified as positive. So, and every estimate that has ever been reported says these are underestimations because so many people are not getting tested, if you don't mind. Thank you so much. All right, so now we're able to see the United States here as well. So how many are vaccinated? We want these bars to be really high. We want them to be really high because that's how we're going to be able to beat this. So you can see here, Wichita is decent. Black African American definitely need some love there. Asian not doing as poorly. They are doing the best within this context. American Indian, Alaska Native, this is where we were talking before. We really have some work to do there, as well as with the Hispanic Latino population. And I want to just be really clear, I am not suggesting this is because of the health department. The health department has done amazing work, and we need more, and it cannot be on the health department. We all need to be working together to make this happen and to get these bars up significantly, if you don't mind. Okay, so this is a lot, but what I want to note here is you'll see some numbers when we're looking at cases, when we're looking at hospitalization, and then death. And this is hard to read and I apologize, but this is all in comparison to white or Caucasian individuals or populations. The first column over then is American Indian, Alaska Native. Take a look. When we're looking at cases, 1.7 times more than white or Caucasian. Hospitalization, 3.5 times more. When we're looking at death, 2.4 times more than white or Caucasian populations. So if you follow over, you can see Asian American are pretty much on par with the white non-Hispanic persons. Black or African American, 1.1 time for cases. Hospitalization is 2.8 times of white or Caucasian non-Hispanics, and then 2 times the rate of deaths. The Hispanic or Latino, it's almost 2 times, almost 3 times, and 2.3 times in terms of death. So we have a lot of work to do, right? So the reason that we need to be identifying people and the reason that we need to be working together on all of this is because there are outcomes, and these outcomes are not good, and they disproportionately impact populations who need our help. And we need to be stepping up to figure out how we can help them best. And I am so grateful that this project is going to occur, if you don't mind. Okay, so this is the piece that I'm going to end on. Now, this is Sedgwick County. So we've been talking about Wichita, Kansas in the U.S. So this is not specific to Wichita. This is obviously broader than Wichita. But I'd like to just point out the good and the bad. And there isn't an ugly on the health department. But we've got the good and the bad. So you'll notice here there's one good, and that is that the deaths are stable. So this is a period of time from the September 12th and all the way to the right of the 7th of November. And you will see that the numbers are decreasing. Terrific. That's why we have green as the good. Okay, reviewing is the hospital admissions data. They're still reviewing that. They don't have those data up ready for this. But what I'd like to point out is the remainder, and there are several other descriptives under this, the remainder are increasing. And that is a recent increase. It is a recent increase. So you can see new cases per 100,000 for Sedgwick County residents. It just started increasing. New cases, the new non-cluster cases, new community disease cases, new community disease cases per 100,000, new tests per 100,000, and the scariest part in some ways, new cases percent positive. We're increasing. So again, the reason I bring this up is not to dwell on specific numbers, but to recognize that this is a trend and there is nothing that is stable about this. And I am just extraordinarily grateful to the people who are continuing to make a real impact and really dedicate their time and quite frankly, their lives to making this happen and helping us stay healthy. Something that many of us are taking far too for granted. Thank you all so much for being here. Thank you for contributing to this very important work. Angela.
Dr. Avila, thank you for sharing the facts about the reality that COVID is still very real. And it's oftentimes, as Representative Finney shared and as Tijuana shared, the work of Facts Not Fear initiated within the Wichita Black Alliance. And I have to say, when you look at the numbers, African Americans are doing so much better than initially. Vice Mayor Johnson was featured, I believe it was ABC, to speak nationally about what was going on with COVID in the Black community earlier when it began. And the state of Kansas made national news because the rate was so disparate and it was so damning for what was happening with African Americans, losing our lives earlier in the initial effort. And when you look at the numbers now, there's still work to be done, absolutely, but it's so much better than it was then. And I attribute it to the effort that we sincerely did to inform, educate, protect our community. And I think we see that now. And I am again thankful that we were able to take that work and apply for federal funds to be able to impact other communities. Because as the data has shown, thank you again, Dr. Avila, there is work to be done. And we're able to take that model and have it in other communities to be able to have impacts so that when we look back at the numbers, we'll see better results. So again, thank you to the Wichita Black Alliance and all of those who worked tirelessly with those multiple meetings, late nights, multiple times a week, for months, almost a year, to have impact. And here we go again to be able to share that and expand that within the entire city of Wichita for other communities. Humbled. So, wanted to go into more details about this grant and what it means and what it consists of. So to begin a bit with the timeline, again, and I want to be able to see and be able to move. Beginning in spring of 2021, there was a notice of funding availability that was extended by the notice of funding opportunity that was extended to from the Department of Health and Human Services Office of Minority Health. The name of the funding opportunity was Advancing Health Literacy to Enhance Equitable Community Responses to COVID-19. And that response was due by April 20th. On April 20th, the city of, and let me back up. There were a number of opportunities that came out for funding to address COVID in minority communities because it was unquestionable the impact and the disparate impact that was happening even early on. Because the Wichita Black Alliance was already engaged in that work and had been through the support of CARES funds through the county, through Sedgwick County, when we learned of the opportunity, we did research and determined that for some of the awards, other nonprofits could apply for it, but for one of the awards, only governmental bodies could apply. And it encouraged partnerships. So once that was understood, we approached the city of Wichita, as well as conversations with Sedgwick County, to see if there was a willingness to partner, to be able to take what the Wichita Black Alliance had done and continue that work and scale it and expand it to other communities throughout the entire city of Wichita. And the city of Wichita was willing to partner and submitted the application in partnership with those of us from the Wichita Black Alliance that had been engaged and involved in the trenches on the work within the Wichita Black Alliance. And we learned in June that we were selected for that award. And again, I want to reiterate just how major that is. Again, there were only 73 communities in the entire nation that were selected for the award. And we were the only community in the entire state of Kansas that was awarded. On August 3rd of 2021, Wichita City Council unanimously, every single member of Wichita City Council voted to approve the acceptance of the award. You can go to the next slide, please. That's really small, sorry. But what that is just going into the details of the award from the Department of Health and Human Services. Acknowledging the term of the award, which is a 2-year term, 24 months, from July 1st of 2021 until June 30th of 2023. It's to the amount of $4 million, which was the maximum amount allowable. It is to continue the work of the Wichita Black Alliance scaled to again impact all minority populations with a focus specifically on the Black African American community, the Hispanic Latino community, the Asian community, and the Native American community. We can go on to the next slide. Again, the purpose of the funding is called Advancing Health Literacy. So the purpose of the funding is to be able to take culturally relevant information and get it into the hands of the community so that the community is better informed, better aware, and better able to respond on how to prevent COVID. Again, our target populations are the Black African American, Hispanic Latino, Asian, and Native American populations. Allowable expenses for the award. Again, it's a health literacy award. Similar to the efforts of the Wichita Black Alliance, the majority of the funds will be going toward marketing and communications efforts. We'll continue to push commercials. We'll continue to push tangibles such as the shirts. That's why we really wanted to have the backdrop so you all can get very familiar with. You're going to see the, matter of fact, you're going to see this a lot because we're going to push out this effort, let it become something that's familiar within our communities and something that people will look to as a source of support, a source of engagement, a sort of how to stay safe, a source of how to know how to stay safe in addressing COVID within our communities. As a part of this grant, there are 3 plans that we are required, and let me not stay in one spot too, that we are required to develop. We're required to develop a disparity impact statement, which basically is a summary of what are the conditions in your community. We have completed a draft form of that, and we'll continue to update that as the numbers change and as more data is made available to us. We're also responsible for creating the health literacy plan, and a health literacy plan that recognizes those cultural nuances and differences that actually impact how or if people receive care and the type of care they receive. So we are working in partnership with the Sedgwick County Health Department and with other providers to be able to have culturally sensitive, relevant health information and interactions with our minority populations. And we also have to have an outcome and evaluation plan, which is a plan that's designed to ensure that the work we are doing is legitimate, that the work we are doing is impactful, and that the work we are doing, the funds we receive, is substantiated. So there is an inherent accountability in what we're doing. And we are appreciative to HHS for ensuring that for all communities that are awarded, it's been vetted and it is an inherent accountability that is a part of it to support legitimacy of the work. The lead organizations and our responsibilities. The City of Wichita is the funding, or is the awardee, meaning they are the recipient of the funds directly from the Department of Health and Human Services. Community Connections Consulting Services, or C3S, is the subrecipient project administrator. That means we're responsible for developing the programming, implementing the programming, hiring one of staff, entering into contracts on behalf of the work. Mamarazzi Communications is our community outreach and marketing manager, and that's Ms. Tijuana Hardwell. She is responsible for all of our marketing endeavors, as well as our community engagement work in partnership and managing our community facilitators, some of which you've been able to meet tonight. Proud to, I guess, announce that our partner for our research and evaluation is going to be the University of Kansas School of Medicine, Wichita. Woo! And to share in that effort, that they were selected out of a competitive RFP process, and they submitted a stellar RFP. And we're very fortunate to be able to partner with them, an organization and entity that's already engaged in this work in many spaces, an authority that truly knows the work and can truly speak factually about the importance of the work. So thank you for being our partner, and thank you for speaking from legitimacy of what's really happening and the facts of COVID and getting rid of the fears. And then our partner, Sedgwick County, the Sedgwick County Health Department, who is the holder of our data and assists us with ensuring that we have data available to be able to continue to do the work and monitor the work and the impact of the work. And again, these are our lead partners. So I will turn it over to Tijuana to share more about our local mobilization efforts.
So much. You all didn't tell me earlier that my mask was upside down. I can't trust this crowd. As Ms. Angelin shared with you all, I am responsible for the community outreach efforts and as well the marketing. It was really important to me in this role that we did not get started with shaping and framing the actual messaging for these communities without input from our community facilitators. I am so excited for the community facilitators that have now joined the Facts Not Fear team. Each of these community facilitators, our team of community facilitators, is responsible for making sure that we involve the community in shaping that message. That is so valuable because what we do know is that too often people have thought that they could shape the message that goes out to these communities, and it's been incredibly ineffective. We know for sure that making sure that the community is involved in that messaging and shaping that messaging, that we have community buy-in and input, that can get us on the right track. I do believe that that's why we do see so much success. Last year, when I served in a similar role with Wichita Black Alliance on the hashtag Facts Not Fear campaign, it was so important that we made sure that we involved so many different African American business owners, business leaders. We involved elected officials, community members, people who had lost loved ones, those who had been directly impacted by COVID. I believe that that is the reason, that we were able to be so successful with that campaign. I cannot tell you how often people shared with me that, hey, that campaign, or sometimes they shared with me and didn't even know my involvement with the campaign. And they shared that, hey, I just watched a town hall in which health professionals, there were doctors on there who shared with us that this is the right thing to do. Shared with us that, hey, this vaccination is safe. It is our best protection right now. So to get an opportunity to be on the other side and get to hear that feedback, undoubtedly, we do know that we did have impact. Moving forward with the Facts Not Fear ICT campaign, we will implement those same practices. So you all will be called to come and participate in community listening sessions. We value your input, and therefore we want you all to be at the table as we shape what this message looks like. What's the most important things in each of these communities? It's also incredibly important, you all, to note that we're going to be mobilizing people to come together and be responsible for sharing best practices with their family members, with their coworkers. So in the work, we are not alone. You all see us up here today, but understand that the community facilitators, they're going to be our eyes and ears as well with making sure that we do get community input throughout the duration of this campaign. It will shape our work. As well, we will involve media partners in this. Super proud of just the work that we've done all together. The community listening sessions, which are to come, and as well the presence that Facts Not Fear ICT will have. So our community facilitators will work truly as ambassadors with our message, making sure that we can save lives, that we encourage people to continue wearing masks, that we encourage people to vaccinate or to consider vaccination. What we do recognize is that in each community, there are fears. There are people who really want to make sure that they're making the right decision. And we respect that. We respect all of those differences, all of those opinions. But we do want to overcome the fear as well. Hence, Facts Not Fear ICT. Incredibly important, the work that we look to do. As I shared, we are going to engage through community listening sessions. Our impact and presence in the community is going to be felt. As Ms. Angelin shared earlier, you're going to see this logo everywhere. But it's not just about the logo, it's about what it represents. As well, we are going to connect the public to resources including, but not limited to, COVID-19 vaccination and testing, food and mental health resources. Our community facilitators will always ensure that they know the different community events that are going out there so that we are able to disseminate information. As well, we want to ensure that these community facilitators are able for you all to be able to contact should you have questions as it pertains to these things. And so the work that we're getting ready to do, I'm super proud of. I'm so proud to be a part of this work and this mission. So I thank you all so much. Ms. Angelin is going to share some next steps with you all. And as we prepare to wrap up with this portion, I do want to encourage you, do not leave without taking a photo at our backdrop and also recording over at the video drop. So do not. And we have goodies over to my left. We've got shirts over there in case you did not get one when you checked in. So please do not leave without that. But I appreciate all of you for being present.
And we want to be respectful and mindful of your time, so we are gearing up to finish up, but wanted to definitely let you know what our immediate next steps. So as I shared, we had a request for proposal process to select a research and evaluation partner, and we have done that. We are in the process of hiring community facilitators. Some of them you have been able to meet. We'll do a formal announcement of who they are and let you learn a little bit more about them. I can tell you now they are all amazing. They are all amazing. So really looking forward to the work that they are going to be doing for Facts Not Fear ICT. We are expanding partnerships. This is not an effort that is intended to reinvent the wheel. We are preparing to be able to support what is currently happening as far as efforts to eradicate COVID. So we are looking to expand partnerships. We've named some of them. We're in conversations with other community organizations and for partnerships as well. And you'll begin to hear more about those partnerships as the weeks move forward. Also, we, effective today, have our www Facts Not Fear ICT website, which is live. It is the beginning of it. We're going to expand it more, but that is now live and available today for you all to begin to visit. And we ask that you visit it frequently and often. That is going to be the source for our updates and information that's happening with the campaign. We also currently already have our Facebook page, and we're also streaming live, by the way. So feel free to share that if you are on social media with others, to encourage them to learn the facts of the work and to be able to become engaged and involved. As Tijuana shared, this is not an individual effort. This is not an effort of just the city of Wichita or just C3S or just Mamarazzi or just KU Med or just the health department. This is truly about engaging community at that grassroots neighborhood level. And in order to do that, we need to be informed by the community of how this work goes forward, how this work can be most impactful, and also to be held accountable for the work. So again, inherent in this process is an advisory body. And you may notice on your table, it gives more information about the Facts Not Fear ICT advisory body that we are currently in the process of forming. We do have some committed membership already. We're looking to expand that. And again, the purpose of that advisory body is to be able to not only receive information about what's happening with this work and what's happening in our community to impact COVID, but also to be able to disseminate it within their respective networks. It's also the responsibility of this body to be able to, as I mentioned, to hold this work accountable and to be able to shape and inform how do we go about moving this work forward and doing so in a way that's truly manifesting and making a difference in these communities. So with that, if you are interested in being a part of that process, please, if you're here in person, if you can provide your information so that we can be back in touch with you as we move that work forward. If you are watching this virtually, there's going to be a link in the Facebook for you to be able to click on. And we'll also share it on the webpage as well on how you can become involved with this work. And again, we're looking for organizational participation as well as individuals who are of these communities, who have a heart and a passion for these communities and want to be a voice for these communities. So please share that word, and if that's you, please sign up. We can go to the next one. Now, with no further ado, we do have a really big announcement for you all. Ms. Tijuana, are you available? And do we need a volunteer? We need any help, or how do you want to do this? Want to see if we can get a volunteer, or? So, as we mentioned, the funds that we have available, before you all share, okay, the funds that we have available have multiple purposes and ways that we can utilize them. Again, this is a health literacy effort, so there's going to absolutely be marketing, as we mentioned, in communications, commercials, things of that nature, which is very expensive, but very important. But we wanted to ensure that there was a way that we could also support what's happening in this community and to be able to undergird and further work that's taking place in other ways and to encourage more work to take place to have more impact in these communities. So we want to present the community with a gift. Our big announcement is a check. Through Facts Not Fear ICT, we are going to make available $500,000 to be seeded into making a difference in Black Hispanic, Black African American, Hispanic, Latino, Asian, and Native American communities with focused, targeted efforts to get the word out and make a difference. What's going to happen is there will be a process for application for these funds. We are looking to have this process in place after the first of the year. But the importance of that advisory body is that it's going to be key also in shaping and framing that process. Because again, this is about community, it is about accountability, it is about sincerity to saving lives, it is about a work. And we want to empower this community and those communities to be able to make a difference and save lives. And that's what Facts Not Fear is going to do. We are humble and proud to be able to do that. We look forward to this community's partnership in making it happen, and we look forward to being able to literally save lives through a sincere effort to impact and eradicate and stop COVID here in the city of Wichita. So again, it was through this grant that we've been able to do this, and we're looking forward to, again, when we come back and look at numbers, Dr. Avila, next year, being able to see impact happening as a result of targeted, direct efforts to make a difference, which was the purpose of the funding because it was needed in this community, and we are thankful that we have been able to secure it for this community to make a difference through the work and hands of all of you, both in person and virtually, and those who will see this later. So, that is our big announcement. So we want to bring Vice Mayor Brandon Johnson forward, please, to be able to provide some concluding remarks.
Well, good evening, everyone. Man, I thought I'd hear a little more after $500,000 was going out to the community. Well, one, thank you all for being here today. I just want to thank again Ms. Tijuana, Ms. Angela, Ms. Sarah. This is great work. I'm really excited about what's to come. As you've heard throughout today, this was based on work of the Wichita Black Alliance. And this is a great opportunity to expand into different communities, keep this work up. And even with the big announcement, you continue to see it's about community and investing in our community, making sure we're safe and making sure we know what's going on. I am just really excited about that. I didn't know what the big announcement was, so that's great. That's why I'm smiling. I won't keep you too long with what I have to say. Just again, I'm really excited about this work. Representative Finney talked to you about where we were last year and what we were facing, what we saw that was going on across the country, what we saw going on in the state, and what we were worried about happening here in the city. Given more context, when we got back from DC, it was 2 days later where we canceled the opening of the NAFSCR, the big ceremony. We didn't do that. And shortly after that, we were all on the phone consistently trying to figure out what was going on, and just seeing people come together as community, and me having the hope and belief that we can see that in our Asian, our Native, our Latino communities is a beautiful thing. Not only will it save lives, like Tijuana said, we heard those stories, but just to give you a personal testament, I wasn't going to get the vaccine. And I said that to the Black Alliance. It wasn't until we did the town hall and I saw Dr. DeHart, DeHart's daughter, well, she's Dr. DeHart as well, and Dr. Duggins, who I have a great respect for, talk about the science. I'm a bit of a nerd, so mRNA research is something that was pretty cool to me. But having them break it down and then say that they took the vaccine themselves, and then having a sidebar conversation with Dr. Duggins later, because the Black Alliance featured people you could talk to, you could reach out and touch, you see them. Those conversations convinced me that the vaccine was safe, and so I got it. And then I wanted to talk to everyone else about that. And being able to see different leaders from these different communities having that same opportunity to talk to folks, I think is going to be extremely powerful and really make Wichita an example around the nation. It was brought up earlier that we did an interview with ABC. What I haven't said publicly too much is through all the networks I'm in, National League of Cities, League of Kansas Municipalities, now the journalist I know at MSNBC, I haven't heard of any city in America doing what the Wichita Black Alliance did here in Wichita. No one has confirmed to me that that's happened anywhere else. And so Wichita can really be a leader in this country from this work, not only from what the Black Alliance did, but from what we're about to see here in all these other communities. So I'm really excited about that. I know that we have competent, talented, skillful leadership that's going to make this happen. And again, that's why I think this effort was supported by so many organizations, not just one group, not just one person, but so many organizations, some here today, some not. You see all those letters of support. That's what makes this work. Us all coming together, working together to better our community. So again, I'm excited about this. Had no choice but to support something so awesome. And again, seeing what's about to happen is great. I'm gonna grab a shirt too before I leave so I can wear that, because I know Miss Tijuana, Miss Angela to say something to me if I don't. But again, I hope you all get a shirt. And I just want to say thank you for being here, caring enough about this work to have your presence felt today, and looking forward to what's going to happen with our numbers going down, our vaccination rates going up, and our communities uniting and staying together for the betterment of us all. So thank you.
And so as we conclude, we want to move forward to just highlighting some more of our partnerships. And again, these are not all of them, as well as we can continue forward. Want to say a special thank you to our hosts for and I see them out in the hallway, just she waved back, for hosting us tonight, as well as for the vendors who supported the effort through a number of services provided as well. Thank you for that. We can go on to the next one as well. As we have mentioned numerous times, please take a moment to share your beautiful masked face with us at our backdrop, and also if you could share some words and sentiments as well, that would be greatly appreciated. And we want to again acknowledge the source of these funds and what this work is for. And we want to conclude with our final slide by saying again, thank you. Thank you for coming and celebrating this next stage in this work. Since being awarded, there's been a lot of work happening behind the scenes to get to the point where we could come forward publicly and have an official kickoff as we are getting more things in place. Again, encourage your neighbors, your family, your friends about the importance of those best practices. Help get rid of the fears, help push the facts, and continue to look to us as a support on how to do that. Again, thank you for joining us this evening, and we look forward to seeing you all at upcoming events and social media, hashtag Facts Not Fear ICT, sharing and highlighting the work that's moving forward to support our Hispanic Latino, our Black African American, our Asian, and our Native American populations. Thank you and good night, everyone.
Lessening the impact of COVID-19 in Wichita's minority communities.